Okay, so I've got my dog under anaesthesia, so I'm just going to go ahead and do a quick check of its head. We're going to just feel all its lymph nodes, make sure nothing's swollen there, make sure we're in good condition, we've got no lumps and bumps, our lymph nodes feel good, our salivary glands feel good, and we're going to go ahead and take an opportunity just to look in the mouth. So we're checking all the soft tissues. We're going to take a look at the tongue, the soft palate, the hard palate, and the gingiva. We're looking for any signs of masses, any redness, any swelling, any lesions, and we're also just assessing the teeth to see if there's any obvious fractures, any retained deciduous teeth, or anything that might need extracting. So far everything looks good. There is a little bit of a build-up of calculus, but our gums look good, they're not red or swollen. So we're going to go ahead and start the dental. And place a gauze in the back of the dog's mouth. This, along with the endotracheal tube with the cuff, will just stop too much water going down the back of the throat. Of course, there in the back of the throat, we're going to go ahead now use the ultrasonic scaler to start cleaning the calculus off of the teeth. So starting at the top of the tooth, working down towards the apex, taking care not to leave the scaler on the tooth for longer than 15 seconds. We don't want to cause any thermal damage or any mechanical etching. So working in short, small strokes, making sure always work downwards towards the apex of the tooth, and we don't want to use the tip of the scaler, we just want to use the side just to avoid any damage to the teeth. Making sure to work in, making sure to cover all the teeth and all the surfaces of the teeth. Used our ultrasonic scaler. We're going to go ahead and use our handheld scaler to clear some calculus off of the teeth. So the handheld dental scalers have 3 sharp sides and a sharp tip. So we use them supragingivally on the teeth, so not under the gum. And we're going to go ahead, same with the ultrasonic scaler, using a sweeping downward motion. Again, applying a light or a firm pressure, making sure not to cause any etching on the teeth. And again, making sure working all of those sides, starting at the crown of the tooth, working down to the apex.
Maybe get back on twice a day, do an anti-itch shot, and then change the food.
Subgingivally under the gum line, we use a handheld curette, so we're going to just use the modified pen grip and working up gently under the gum line. So these the curettes have a blunted tip to cause less trauma to the gums. So again, working downwards in a sweeping motion, making sure to get up under that gum line.
Because it only lasts like
18 hours.
Yeah.
So if it's not lasting long enough, we need to do the cat. If it's paretic, then we need probably conduct topic.
Okay.
Switch to kangaroo.
Okay. So we'd order it for them, or do you have
That's my backup. Well, I mean, we don't have any samples. They don't give samples of prescription food.
Yeah, you're right. But if you don't like it.
Take our rinser, handheld rinser, and just rinse the debris from those teeth. So making sure to start at the back of the mouth, rinsing forwards. We don't want to push too much water down the back of the throat. Okay. Scaling the teeth, we're going to go ahead and polish. So I've got my Prophy cup here and my individual Prophy paste. So we're just going to go ahead and load that up into there. And we're going to start polishing those teeth. So we're going to press the polisher to the tooth for no longer than 2 or 3 seconds, keeping it continuously moving around just to avoid any thermal damage, making sure to work that Prophy paste in well and on all surfaces of the teeth. Alright, so now we've finished polishing. I'm going to go ahead and rinse out the mouth again, making sure get rid of any debris and just clean that polish off the teeth so we can, or the excess polish off the teeth so we can see for a post-cleaning exam. Again, making sure to push the water towards the front of the mouth and not the back. So then we're going to go ahead, I've got my dental chart here. And I also have my periodontal probe, so we're going to probe the teeth and check the depth of any pockets between the teeth and the gums. So just doing a quick post-cleaning check, we made sure we got removed all of the calculus from the surfaces of the teeth. And then we're going to go ahead and use our probe. So it's important when using the probe we go at an angle that's straight onto the teeth so we can check any gaps between the teeth and the gums. So making sure to check all of the teeth and the whole tooth. We're looking for any deep pockets. And as I'm going ahead and doing this, we're going to carry on and fill in our dental chart as well. Post-cleaning oral exam is done, all our teeth have been probed, didn't find any significant problems. I'm just going to go ahead and do one final rinse. Okay, and then just before we wake the dog up from anaesthetic, we're going to go ahead and just clean up any areas around the fur coat that may have got contamination on them from the cleaning or any blood and water. So I'll just grab a towel. And we're just going to wipe up the hair coat around the mouth. And we want to make sure the dog looks presentable before it goes home to the owner. And then once we're recovered from the anaesthetic, we will go back and just check that the dog looks nice and clean and ready to go home.